Thank you everyone for joining us today for this webinar on Project Impact Healthy Aging, where we'll be sharing some insights from our 2025 cohort. My name's Laura Katawaki, and I'm a Research and Knowledge Mobilization Specialist with United Way BC, and I'm very excited today to be hosting this webinar and to have the opportunity to share more about this amazing program. Before we begin the webinar, I wanted to start with a land acknowledgement. So United Way BC acknowledges the homelands of the Indigenous peoples on this place we now call Canada, and honors the many territorial keepers of the lands on which we work. I personally am working from home today, so I'm working from the traditional, ancestral, and unceded territories of the Coquitlam First Nation. And I would encourage you to, if you'd like, share a land acknowledgement in the chat, as well as share your name and perhaps where you're joining us from. A few instructions for the webinar. So during the webinar, the audience will be muted. Feel free, though, as I mentioned, to introduce yourself in the chat box if you'd like. There is a closed captioning feature at the bottom of the toolbar that says CC if you would like to put that on. The closed captioning is automatic, so it might not be 100% accurate, but feel free to use that if it will be useful. There is going to be a question period at the end, so you can put your questions into the Q&A box at any time, or you can also put questions in the chat. And the webinar is going to be recorded and posted on Healthy Aging Core. There aren't really any slides, but we will share out a link afterwards with some more information about Project Impact Healthy Aging. So we have three presenters for the webinar today. First, we're going to be hearing from my colleague, Ian Chian, who is a certified volunteer administrator with over 18 years of experience, and he's currently working as the capacity building specialist with the Healthy Aging team at United Way BC, where he works with organizations to strengthen their systems and resources so they can better support seniors and their communities. And he's going to tell us a little bit more about what Project Impact Healthy Aging actually is. Oh, and I realize I've done a bad typo on this front slide, and it should say Carla Shields. So apologies, Carla, that I did not do that properly. It should say here that our presenter is Carla Shields, who's the operation team lead from Sunshine Coast Resource Center. And Carla is one of the participants from the 2025 Project Impact Healthy Aging cohort. She's the operation team's lead at the Sunshine Coast Resource Center, where she supports programs that help older adults navigate local services, access resources, and build community connections. Her work centers on strengthening systems, supporting staff, and ensuring the resource center remains a responsive and trusted hub for the community. And so she'll be talking more about her experience and project. And then we also have another alumni from the 2025 cohort, Michelle Postnikoff, who holds a bachelor's degree in child and youth care from the University of Victoria. And she's been with Castlegar Community Services for 10 years, where she has been the program coordinator for the West Kootenay Volunteer Driver Program, which is the program she'll be talking about for the evaluation. She is very passionate about transportation issues for seniors and would like to see a provincial plan to better deal with rural and remote transportation systems for seniors. So I'm very much looking forward to this conversation that we're going to have today. I will hand it over to Ian first so that he can tell us more about Project Impact Healthy Aging, and then we'll have a conversation with Carla and Michelle to learn more about the projects that they did and their experience. I will stop my slide share and hand it over to you, Ian.
Thanks, Laura. Good morning, everyone, and thank you for joining this webinar today to hear from Carla and Michelle on their experiences and learnings from Project Impact Healthy Aging from their past cohorts. If this is the first time you're hearing about Project Impact Healthy Aging, or sometimes we shorten it to PIHA, it is an 8-month development evaluation course offered annually by United Way BC, and it's tailored to members of the community-based seniors serving sector, where it equips teams with the organization tools, training, and coaching needed to evaluate their impact on older adults. So what does this look like? It's a blend of in-person and virtual sessions, which each team, I guess each organization brings a team to learn about different ways to evaluate, collect, and determine findings, and then communicate that impact uh, back to their community and their organization so that you're making data-informed program changes. It's not just beneficial for the programs individually, but there's long-term benefits for the sector as a whole. And we're very excited to hear from Carla and Michelle today to hear some of their learnings because in many cases, the data analysis and the learnings extend beyond just their specific organizations. So this opportunity happens once a year. Our next intake for our next cohort will be in the summer of next year. We're just about to start our 2025-2026 cohort actually next week. But it is a program that is available as you can free of charge. So if you're an organization in different parts of BC, there are travel bursaries available to assist with getting to those in-person sessions and assist with participating and things like that. Uh, so we're excited to hear. I don't want to spend too much time so we can hear more about what the learnings were. But if you're interested in hearing more about Project Impact Healthy Aging, I encourage you to visit the United Way BC website. And if you navigate over to our Work and Seniors, there'll be more information on timelines, frequently asked questions, and how to apply and contact information on if you have any specific questions. All this information will be sent out after the webinar as well. But with that, I'm happy to pass it back to Laura to get us started with today's webinar.
All right, thank you very much for that useful context, Ian. And as you mentioned, we'll be sharing out afterwards the link for the information about the Project Impact Healthy Aging if you'd like to look into it. And we'll also share Ian's contact information if you do have any questions. And of course, you can ask questions during the webinar as well about it. All right, so now we're going to turn over to Carla and Michelle. And so I'm really excited that we're going to have the opportunity to hear from them about their experience in the most recent cohort of Project Impact Healthy Aging, and also about the projects that they completed and how they've been able to use the evaluation findings. So to start off with, I was hoping that I could ask both of you just about the program that you decide to evaluate, and then why in particular did you want to evaluate this program? So I'll go to you first, Carla. Would you be able to tell us about the program that you evaluated?
Yeah, we chose to evaluate our community information hub. It's our the main point of contact that older adults on the Sunshine Coast have when they're looking for supports. Some of the things that we support people with are in applications for housing, healthcare, transportation issues. We also have legal aid. And applying for income supports, senior services, technology help, and referrals to other organizations, kind of almost like a yellow pages for, but in person. um, where our services are offered as drop in our office location, but we also have an online directory on our website, and we do community outreach to various other communities along the Sunshine Coast. We stretch across about 80 kilometers worth of highway here on the coast. We chose the Info Hub because it's our longest running and core program for our organization. And the first point of contact for most clients, even with other programs, they usually all interact with the Info Hub first. And the demand for navigation support has really grown over the last number of years with housing crises, increase in digital services, and the need for older adults to have help with accessing those services and income support needs. And we had assumed that we would have clearer defined outcomes out of this program going into PIHA. So it's one of the reasons why we chose this specific program out of everything that we do. And we wanted to move more beyond just the outputs of numbers and stuff and really understand the depth and quality of the work and the impact that we do at in the Info Hub.
Yeah, thank you very much for that introduction to your program. And I think hopefully everyone in the audience knows how valuable those information and referral programs can be. And like you said, it's not just the numbers, but looking at that tangible impact that getting somebody signed up for GIS or a safer benefit really can have on somebody's life.
Mm.
And Michelle, would you be able to tell us about the program that you chose to evaluate?
Yes. So I work for Castlegar Community Services. We are a multi-service agency with many programs. And the program we chose to bring to PIHA was the West Kootenay Volunteer Driver Program, which has been in operation since about 2006. And even though we primarily serve seniors, it started as a way to provide rides to medical appointments to anyone, any age who had a barrier to transportation. We primarily offer services in Nelson Trail and Castlegar, and now most of the West Kootenay Boundary region, utilizing over 30 drivers. We chose to evaluate this program because we wanted to know if and how we were impacting the lives of seniors in our community.
Yeah, thank you. And I think in rural and remote communities, we know how important volunteer driver programs are. So I'm very excited to hear about what you found out in terms of your results. So would you be able to tell us, Michelle, a little bit more about what you found in terms of your findings? And was there anything in your findings that kind of surprised you or was unexpected?
The findings were overwhelmingly positive in ways that we hadn't fully anticipated. So we kind of had an idea that we were helping. But of course, we didn't realize the amount of independence and autonomy that we were providing for our seniors. Seniors don't want to feel like a burden to their friends and family. They want to have choices and options like everybody else, and they still want to be viewed as contributing members to the community and to society. The finding that I think surprised us the most was a choice we hadn't considered as we focused on our clients. Um, We'd not considered the impact that this program has on the people who volunteer to drive for us. We did not include them in our data. However, one of the drivers who helped us conduct the interviews left us an impact statement of her own, wherein she described the benefits of the program for her. And that was kind of eye-opening for us. Like I said, it wasn't something we'd considered. And so to have that valuable piece, and if we wanted to go back and reevaluate now, I think we would also include the volunteers. I would want to know what this program brings to the volunteers.
Yeah, that's really amazing to hear. And I know that volunteer drivers, of course, are at the core of these programs, and it can be sometimes challenging to recruit or retain. So to learn more about their perspective sounds very valuable.
For sure.
And then, Carla, would you be able to tell us about some of the findings from your project and about if there was anything that kind of surprised you?
One of our main findings, we had assumed that we were creating more autonomy for our clients in connecting them to the services that they need and maybe increasing their ability to sort of navigate that world themselves. But what we found through our qualitative interviews was that we're more of a lifeline for seniors who don't have a strong support network themselves. Um, they don't really necessarily become independent navigators of systems because the systems that they're navigating remain too complex. For at that stage in their life, they don't want to put the resources into overcoming barriers that they already have to navigate systems. They'd rather just put their resources into living their lives and um, and not really advancing themselves in that way. Um, and so that's where we found like that their dependency on us for support and navigation really wasn't a negative. It just reflects where they are in their stage of life as aging adults. Um, the other finding that we found is through that support, it greatly reduced the amount of stress, anxiety, and increased their confidence. Clients were feeling less overwhelmed, less alone, and more capable. They many highlighted the fact that they knew that they had somebody to turn to when they came across these challenges, how large of a support that was, um, and that emotional and relational support that we provide and helping them navigate these services was as impactful as the actual result of those services we connected them with. They also another we always thought that our services help our clients feel more connected to the community, um, and what we found was that connection actually comes from the support that we give, that navigation support that we give, but it also comes from our clients then becoming a resource to their communities. So when we're able to help them navigate and feel connected to us, then they can go out and help their people that they come across in their communities to come and be more connected to us, but also feeling that connection to sort of be navigators within their own communities. That was a common theme. The other finding that we found is that there was a real strong need for culturally safe, trauma informed, and client paced support. Those themes came up again and again. The fact that we take the time to really hear client stories. Many are facing grief, housing instability, digital barriers, or cognitive decline. Um, and they need the time and patience and a safe space, which is often lacking in broader service systems. Um, for example, getting help at Service BC for things. It doesn't have, it's very transactional. Um, we also found though that sort of one of our more improve or humbling findings is that there's still barriers for our clients to access ourselves, to access the information hub, which limits the reach of how we can help people in the community. We have transportation challenges, being a rural area that covers a large span in a number of communities. Um, Limited service hours. We like our funding. We only have open service hours from Monday through Thursday from 10 till 2. And the need for more private spaces. We were while we were doing this evaluation, we were in a very small office space with very limited privacy. Um, um, and it gave us those findings helped us guide. We were in the process of finding larger office spaces, but they helped create more equitable plans in our expansion plans to address those issues.
And would you be able to tell me then a little bit more about how you were able to use the findings to improve your program? You've already alluded to it a little bit, that you identified some strengths, but also some areas for improvement. And so then how were you able to, or were you able to implement some of these findings?
One of the great things about going through this process and conducting our qualitative interviews, we're interviewing one-on-one clients, is we were able to make changes as we were doing our interviews. Very quickly in our interviews, we found that people were expressing how frustrating it is when they have to repeat their story, their history. When they interact with us, and they talk to one staff member one day and a different staff member on another day, or volunteer, and the frustration that comes with having to sort of go through that history and history. So we immediately, even before we were done sort of analyzing our results, made more of an effort to designate one staff to each client, and change the way that we document our client histories so that it's more easily accessible to when multiple staff members are helping one client. Then we can get a better read of whereabouts we're at with that client. We also again, enhanced our physical space with some of the things that were highlighted as needing to be improved. So as we were searching for a new space and then designing the new space, we were able to design a more comfortable and open reception area and private office spaces for sensitive conversations, or even in our larger open space, being able to create distance so people feel a little bit more able to share. And we designed a seniors gathering place that helped to reinforce belonging and relational connections. So we're not always sitting across a desk from each other. And we immediately highlighting the improved findings of like the travel barriers and stuff. We've increased our community outreach to have to go out to outlying communities. Um, we've been able to work with food banks in those outlying community to set up a little satellite hub so that even people who use those food banks, or even if people don't normally use those food banks but need assistance, we are able to say, hey, we can meet you in your community on this date type thing. And also partnering with senior centers and health centers as well, so to have sort of more outreach to those locations. And it's also our findings helped with advocacy with our funders. It changed the way that we talk about the services we provide. Instead of being a hub for information and referral, we are really a hub for navigation and support. And that's a big difference and shift in the language that we use as we apply for grants. And then we also are integrating, out of seeing the benefit of evaluation, and we're still working on this part. We haven't fully gotten it yet, but we're working on integrating evaluation into our practice on an ongoing basis. And really using the evaluation to follow up with our clientele. And because we really, through conducting our interviews, found that the follow-up is actually quite beneficial because you end up finding out more information, more help that they need. So integrating the evaluation into that part.
Yeah, it sounds like your findings have really helped you to, I guess, make your service even more person-centered, it sounds like, which is great. And then also, it's really interesting to hear about the advocacy piece and the decision to hopefully embed that evaluation into your ongoing processes. So that's great. And Michelle, I'd be interested to know the same question for you in terms of how your evaluation findings have impacted your program.
The evaluation of our findings opened up some new discoveries for us. So it was revealed that we needed to get noticed. Lots of seniors know about our program, but lots still do not. We were advised that we could do more in the way of advertising and more in the way of informing other health agencies of our services to let their clients know. Some of the systemic barriers, such as Handy Dart and BC Transit, were also brought to light. And while not surprising to us, it was nonetheless interesting to see how these barriers impact our seniors. And so not necessarily something we can fix on our own, but that other people are aware. We were aware ourselves, but our clients also shed some light on the fact that bumping into those barriers is hard for them. So yeah.
Yeah, and you mentioned also earlier about the volunteer piece and about how the findings made you more aware about the impacts on the volunteers. And I'm wondering if that's impacted at all then how you interact with volunteers or plans about future evaluation with volunteers.
We definitely have plans. Like I said, we'd like to do this again and then include the volunteers in our study. We've since had conversations with our volunteers to, not in a formal manner, but in some informal manners to see what some of the impacts are on them and what they get out of it. And just that for lots of the volunteers, that's a social connection. It's giving back. It positively impacts their day. And And then some of the other things with the volunteers is that there's pockets of volunteers. So of course in the major hubs, there's lots of volunteers, but then in some of the siloed communities or the valley communities, there's not as many volunteers. So how do we get more volunteers in the valleys, in the corridors to help get people back into the main towns? So
Yeah, those are some really interesting insights about the volunteers. And I wouldn't have thought myself when I think about volunteer driving, I don't necessarily think of that as a super enjoyable activity, maybe because I don't like driving, but it's really nice to hear that for the volunteers themselves, they're getting something out of it through the social connection and other impacts.
And I think the volunteers that come to us are those that do enjoy driving and seek purpose just as much as another older adult might seek purpose. And so this gives them that sense that they're doing something for their community. And
Yeah, that's so important.
mhm.
And then the next question that I had is whether you encountered any challenges when you were doing your evaluation. Michelle, did you want to start off?
Our biggest challenges was probably dissemination of information. So lots of our seniors are not tech savvy, so distributing information electronically about our project provided challenges. Secondly, as we're merely provide rides for seniors, we weren't collecting emails as part of our intake. And so now we wanted to, you know, conduct these interviews and mass mail surveys. And so now, oh, well, how do we do that when this is not a bit of information that we've collected? The seniors that were tech savvy, however, it might have been an efficient way to send out the interview invitations. So like not having access to the emails was definitely a challenge. We ran into the same challenges with conducting the surveys. An electronic version may have been better, but how to distribute it became a bigger question. In the end, we informed clients via monthly newsletters that went out with their invoices and enclosed the surveys in the same manner, plus mailed out an additional 100 surveys to clients who did not have current invoices. The other big factor for us was time. This project happens in real time. There are no extra hours added to your schedule. And so it was completing the PHA project on top of your normal workload. So
Yeah, I appreciate those challenges that you highlighted because I think when you have programs that are more drop-in or casual in nature, then trying to do that evaluation is so challenging. But it sounds like you were able to find some ways to work around that and did a lot of effort to try and get the word out.
for sure.
And then what about you, Carla? Did you encounter any challenges with your evaluation?
Yeah, the capacity and time. It is an 8 month long project, and we are a small team in a busy hub. So the evaluation was a bit difficult to fit in. We conducted our qualitative interviews, like one-on-one with about 16, I think, participants right as we're in the lead up to our busiest time of year in tax season. We do a volunteer tax program in our offices. Um, but we've in as soon as we started the interviews, we also we saw the impact of the interviews themselves for our clients. Our clients often are very grateful for our services, but don't have a way, to say thank you. This was one way that they could return the favor. But the interviews always sort of unearthed other areas where our clients needed support. So we always knew that not just from gathering data for our project, but that these interviews were actually important and purposeful for our clients as well. So that helped keep us going. Recruiting participants was a little bit difficult, again, with the sort of the technology access. It's easiest for us to send things out by email, but not necessarily easiest for clients that we need to be talking to receive it that way. So reaching out by phone and often recalling and explaining to them what we were doing. We also had to adjust the language that we used in our surveys. So going through the PIHA system, they guide you in creating these qualitative surveys and bringing things in from sort of logical sort of things, but into inside the heart triangle, it's called language of change. So how does our impact change our client? But often that language is quite emotional. And so for some of our senior clients, especially senior men, they were having a hard time understanding what we were getting at with some of the emotional language. So we very quickly had to, like after our first couple interviews, adjust our language again, still getting at the same stuff, but using sort of less flowery language. And then our quantitative data collection. So we sent out surveys, so we did our interviews and then we prepared surveys to get sort of more numerical data. And that was done sort of after we had done our qualitative data. And during our busiest time of the year as well. So we sent out, because we were so busy, we really did send out those surveys out electronically through our e-newsletter, the emails that we did have of clients, and our social media. But the respondents for those surveys were very different from the response, like the people that we had interviewed for our qualitative data. So a little bit more clients with a little bit more access to technology and stuff like that. So it did skew that data a little bit more. So if we were to do it again, we would try to find the time, even though at that time we were quite busy, but try to find more time to do in-person surveys, follow up, especially with the people that we had done our qualitative surveys with, and make sure that those people also did the quantitative surveys or interviews with and surveys. So those are the challenges and how we would address them next time. So that's everything.
Yeah, I appreciate the comments that both of you have made, because it sounds like technology, of course, sometimes it's such a facilitator, but then if the population that you're working with isn't comfortable with it, it can actually become a barrier. So it's interesting to hear about the different approaches that you use to try and address that. And I know from doing research myself how challenging it can be sometimes with recruitment. I'd be interested to know, you both have kind of touched on this a bit in your previous answers, but in terms of what you've learned from this in doing the evaluation, what advice would you give to another agency that was interested in doing a similar evaluation in terms of what you've kind of learned from what you've done and maybe something you do a little bit differently or something that worked really well? Did you want to go first, Michelle? Or I saw Carla had been unmuting, so if you want to go first, Carla, you.
It's okay.
Okay.
Okay, I'm going to say while this program is demanding and continues to amp up as it goes on, the effort is entirely worth it. The sense of accomplishment is very fulfilling. So the PIHA team provides you with skills to complete the projects, provides efficient timelines, and check-in supports along the way. The advice I would offer is to have a team who supports you and with whom you can share the load. We were one of the few teams who had 2 members, and I understand now why PIHA wants you to have 3 to 4, because when we reached the interview stage, we had to pull in one of our volunteer drivers, like I mentioned, to help us out. Also, plan ahead for your distribution process, because this sneaks up on you before you realize it. And it was something we hadn't have thought of until we were there. And it's like, oh, how are we going to let people know we're doing this? How are we going to get these surveys out? How are we going to figure out who wants to be interviewed? So just plan ahead things that we hadn't thought about.
And if I can ask a follow-up question, you'd mentioned that PIHA normally recommends having 3 or 4 team members. And is it normally just staff who participate? Or you mentioned you had a volunteer who actually assisted you. So are volunteers or older adults often involved as well? Or would you recommend that?
It wasn't in our plan initially, but when we got to that stage, we kind of realized we were a little bit in over our heads. And so we needed to pull in that third person to help us out, because we conducted about 34 interviews and there just wasn't enough. You just don't have enough time yourselves to get it done. And so I think going into PIHA a little bit more eyes wide open next time. When they recommend a 3 to 4 man team, they recommend a 3 to 4 man team. And it's I think it becomes obvious when you go down as a 2 man team. It becomes obvious how much work there is for 2 people to do and to still do your job. So
Yeah, and I've got to say, conducting 34 individual interviews is really impressive because even in a lot of like research studies by academics where they have research assistants, they don't get that many interviews. So the fact that you were able to pull that off is quite impressive.
mhm.
And then what about you, Carla? Was there any advice you would give teams who are interested in doing evaluations?
Definitely a 4-man team. 4-person team. We did 16 interviews and it was during our busiest time as well. But we two of our team members did the interviews, so it is possible to do with less. But when you get to the report writing and all that stuff, having 4 people to draw on their various skills is definitely helpful. So we had 4 people and I'm grateful for it. I don't know that I would do any more than 4. um, the other thing too is if you do plan to do the PIHA experience, is to really plan for that in your annual planning, not to plan other program launches or like don't add anything new in during that 8-month period. um, um, and then really like if you're just looking at evaluating program without having gone through the PIHA experience, this PIHA experience really highlights getting to the heart of your impact, how your impact changes your client, the changes that your client experiences in themselves because of the work that you do, because that is where we really got the deep insights into the impact of our work. um, and building evaluation into your workflow, whether you're doing the PHUB program itself or just looking at evaluating your programs on your own, but just building it into your workflow. And if you're going through PHUB, looking at how you can build that into your workflow. We're really we haven't started further evaluation yet, but we are really looking at how follow-up can be an evaluation. And because that follow-up's always going to reveal other supports. So just looking at ways to integrate that. And even just small things like it doesn't have to be a whole cohort or whatever, but if you maybe do it once a month to start, the insights that you're going to find from one interview a month with your clientele is going to immediately start changing the way you do your processes. The things will come up and get highlighted. And then once you gather all that data, though, you get more themes and maps. This is actually the map that we put together in our PIHA study. We've actually framed it for our new offices. But you do sort of gather a larger journey. But yeah, the value of storytelling, like these interviews, they're basically a story that you listen to and analyze, and it does you get insights that you don't get in just continuing to do your work. And then just focus on learning, not perfecting the interview process or the quantitative data process, like all of it, the process itself makes changes in the way that you do your work.
Yeah, thank you. That's a really nice diagram behind you. I'm glad to hear that it was from PIHA and that you found it so valuable. I'd be interested to know, because both of you mentioned, of course, about the value of having a team. It's not a one-person job, but I'd be interested also to know about what the value was in terms of PHA having the instructors and then also having a cohort process where there's other teams who are working on projects as well. Did you want to start,
Yeah.
Carla?
Yeah, that was definitely like the value that you get out of doing the PHA process is far beyond what we thought we were going to get out of it. It's almost it's university level courses taught by a university professor. It is doing analysis and data that people who've done master's degrees and doctorate degrees have recognized the methods of. Um, so it's definitely I highly recommend if you have the opportunity to and the resources to do the PHA route. It's definitely good. Um, I've lost my train of thought here. What was a
It was
second?
about the value of having the PHA instructors, but also doing it in a cohort model where you're
Yes,
working
the
with other
cohort.
teams as well.
Yeah, the cohort part is definitely helpful. You see the challenges that everybody else has and the successes. Some teams came out of the gate very strong, and you sort of saw how they were like where their strengths were, and you tried to have sort of copy sort of that bit. We all have the same challenges. We're all not nonprofits with limited funding and lots of workloads and not many hours to do all this. And the questions and the challenges that we all had sort of some people had solutions and we learn from that. And it's a great opportunity to connect with people who are doing similar but different work, like similar work, frontline work, interacting with the clients themselves, but in different ways. And you end up learning about like Michelle's program with the volunteer drivers. We have volunteer, like we don't in our organization have a volunteer driver program, but we have a volunteer driver program on our Sunshine Coast as well. Yeah, there are like all sorts of different things you learn about the different experiences and the stories that you hear from other groups. They're all very impactful and very valuable.
Yeah, and I can definitely see from what you both have been speaking about the common challenges that are faced, but then also some unique differences for each project.
Mhm.
And Michelle, would you like to give any comments about the cohort model for Project Impact?
Yeah, I would like to say first that PHOD does a really good job of taking this big, bad, ugly word that we call statistics, because all of us are afraid of statistics, right? And we think it's none of us know how to do it or none of us do it well. With PHOD, that didn't matter. They made it less scary and they break it down into components for you and help you see why it's important to collect stats. Um, and being in a cohort as well, I think we were all pretty scared when we came in, and I think we were all a lot less scared when we left. Um, and that you're all in the same boat, like we're in different boats, but we're in the same boat. And so a lot of the challenges, we shared those challenges. And like Carla said, we have workloads, we have budgets, we have, you know, the life of a nonprofit, and to see what the other teams were doing and programs you don't even realize are in the province. And it's like, why don't we all have these programs? Because there was some amazing things brought to the table that I had never thought of, I'd never heard of. And then they get your brain flowing, and it's like, how can we take some of their ideas and bring it back? Or so it was just really quite great. And I would also just say lean into the group, like get to know who your cohort is and what they do. And the cohort reminds you that you're not alone, and that they're going through the same growing pains as you. So um, just an overall, I have nothing negative to say about PHAR. It was all amazing, and I would do it again. Even now, knowing the amount of work that goes into it, I would definitely do it again.
I'm glad that you've both found it so valuable. And I like that phrase that you used about the big bad world of statistics, because I think is very true. That's how a lot of people feel about statistics and when they see the numbers. So I really appreciate you bringing up that point. So I know that we're at 10:45. So maybe I'll give you each a opportunity if there's a kind of a last word or comment that you want to have, and then we can move on to some audience questions because I want to make sure there's time for the audience to ask. Would either of you like to pass on any additional lessons or kind of like key learnings that you'd want the audience to take away?
I can go. The one big thing, and it seems obvious, but the relational work is where our impact is. And I think that's probably it's true in many of the people that we were in the cohort with is that is the relational work, not the results of the work, is where a lot of the impact lies for our clientele. Is not transactional. Um, Trust, time, patience, human connection. That's what matters most to seniors and aging adults. Um, Small interactions in our work create big change, like just paperwork help or digital support. Like it reduce the stress reduction that happens or the ease that that creates in a person's life is tremendous to older adults. Um, and evaluating your program will only improve the way that you deliver your programs. And that's what we're here to do, right? Is to keep improving the way that we can serve our clients. So
Yeah, and I really appreciate that comment about all the work being so relational because I think that's something we see with most CBSS sector services that really at the heart of them, whether it be volunteer driving, grocery delivery, information referral, or recreational programs, really it's about the social connection that people want to have and the relationship you can build.
yeah.
And then Michelle, was there anything you'd like to share?
I'd agree with Carla. It's relational work. Even in the negative comments that you get in the interviews or in the surveys, because you're going to get negative comments. Not everything about your program is sunshine and roses. There are negative sides to everything. But I think it's about taking that negativity and learning from it and just listening to what they have to say. And I think them knowing that you're listening is huge for them. And so taking the little things that they might say and thinking, okay, how can I fix that or how can I improve that or make it slightly better? Even if it's something you can't change, such as, Handy Dart and BC Transit, it's giving them the space to talk and that you are listening and that you are passing that information along to maybe someone else who can help with that issue. So being prepared for that as well. Yeah, and just learning, just being willing to learn and being open yourself about what you're hearing. So,
Yeah, I think that's a really good point that not all the feedback you're going to get is going to be positive, and sometimes it's not all very constructive, but you've got to take what you can and learn from it if there are constructive suggestions for improvements or ideas for things you could do differently. So thank you very much for sharing that, because I think that's a important part of evaluation that you hope your findings are going to be good, but sometimes there might be some feedback or findings where there are things that actually aren't working well. Yeah, so I think now, thank you very much, both of you, for sharing those insights and the information about your experience with the project Impact Healthy Aging. And so I'd love to go to the audience now to see if they have any questions. So we have the Q&A box currently, if you'd like to type in any questions there. And then I'm just going to make sure that everyone in the audience can participate in the chat. I'm not sure if it's been enabled yet. So I'll ask my colleagues who are doing the tech if they can double check the chat. But for now, if people want to put their questions in the Q&A box, that would be great. And then I can read them out for our panelists. All right, and maybe while we're getting the chat sorted out, sorry about that, I can ask one more question of our panelists. So I'll be really interested to know in terms of the evaluation process. So you mentioned that you did surveys, you did interviews and other forms of data collection. And so I'd be interested to know, in terms of evaluations, and if you were going forward and doing another evaluation, would you do similar data style collections? Do you have other ideas about how you might be able to get effective feedback from the participants?
Yeah, I feel now that we've been through this PHAS process, um, we can use our interview questions are we wouldn't change them much because we did a lot of time on them. Definitely our survey questions, I think we would improve that a little bit more. And then the way that we get the survey data, doing more in person and stuff. But um, basically we have a base of knowledge of the questions and everything that we just modify some of the questions just slightly. Um, and it really does apply to multiple programs in our organization. So we definitely wouldn't be starting from square one again at all. And we've had like one thing too through this progress is you have a coach that you can meet with multiple times weekly, even to help guide you through this process when you are outside of the main learning times. So there's lots of support. The big bad word, scary word of statistics shouldn't scare you off because Annalise did most of our statistics for us. So we did the work of gathering the data. So yeah, it definitely it gives you a good base to start from.
Yeah, that's really interesting to hear about the cross applicability in terms of the skills and even some of the questions being able to use them potentially for other programs. And then Michelle, would you like to share anything? I know you mentioned about some challenges in terms of doing the survey online and
I think it's changed how we look at intakes and even in more recent light with the Canada Post strike last year and this year, trying to figure out other ways to get to our seniors and figuring out which seniors have electronic access. So I think it's definitely changed how we look at things. And are there other ways that we can be reaching them, even if it's not electronically? Are there other ways where we're not relying on just, word of mouth or newsletters or and then I just think doing this process like of evaluating, I think it's definitely useful to have this in your back pocket and decide, do we want to evaluate annually? Do we want to evaluate every other year? And just having those options at the ready. And like Carla said, we've already done the hard work. So maybe only having to tweak it a little bit and do it again. And like I said, you learn from both the positive and the negative comments as to what you're doing right and what you need to continue to improve on. And I think that is huge for all agencies.
yeah, and I really appreciate what both of you have said about I think the transferable aspect in terms of the skills and what you learn from the program.
Mm-hmm.
And I think we do have the chat working now. If anybody wants to put anything in, we do have one question already. So this question, one of the findings that was mentioned was seniors don't want to be a burden to their family. Is shared responsibility also mentioned in the evaluation? Was that something that came up in the evaluations?
Jamie, can I ask what you mean by shared responsibility? Can you shed a little bit more light on that?
Yeah, Jamie, maybe you could put another comment in the chat, or we can unmute you if you'd like to respond verbally.
So
I think shared response. Oh, so go on.
sorry, maybe not to put her on the spot or so one of the things that we noticed in the research was how important older adults independence and autonomy is and that they want to be able to decide. So right now, the age that maybe the majority of us are, we can get up, we decide what we want to wear, we decide what we're going to have for breakfast. We can decide to go out into our car and go wherever we want, whether that's to lunch with a friend, to a doctor's appointment, wherever we need to go that day to get simply to do simple things such as get groceries. And for a senior after the loss of their license, that's not so easy. Choices are not quite their own anymore. And while for some, they have very involved families, others do not have involved family and or don't have family at all. And I think for them, it's just a matter of choice. And so I think having access to the volunteer driver program, they kind of still have a little bit of that autonomy. They maybe can't call me up in the morning and say, hey, can I go here? It takes a little bit more planning, but they still have choices. So I have a doctor's appointment. I also need to go get groceries. Can I set up a drive to do all of these things? And is there going to be someone available to let me do all those things? And so I think it's just that. I think it's providing the choices for the senior and knowing that they could call family or friends, but that they, if and when they don't want to, that they have other options to get a ride.
That's a similar theme too for our clients and completely different situations, but um, not every senior has supportive family available to them or family available to them just in vicinity to help support. And so that shared responsibility is also part of the community's responsibility is to share that responsibility to support our seniors. Um, and because many have traumatic experiences or relationships with their family and don't like if you have a senior who has dyslexia and cognitive decline and having a hard time reading a form or following the steps of a form or whatever, having somebody to be able to turn to that isn't going to make them feel worse about their inability to do the form is important, and that's not always available in many older adults who also face other challenges and barriers, families. So
Yeah, thank you both for those answers. I think you've answered Jamie's question because Jamie said thank you. So I think you got at what was being asked. I think we have just a couple minutes left. So if anybody wants to put in a last question in the chat, it is enabled now. Sorry very much for those technical difficulties. So I'll just give a moment. Okay, well, I don't see any more questions coming in yet. So I think in that case, we can move to the conclusion of the webinar. So I'd really like to thank our presenters, Carla and Michelle, for sharing about their experiences with Project Impact Healthy Aging. I think it's a really inspiring program, and it sounds like you got a lot out of it. And I really appreciated how you talked about the realities in terms of the challenges, the negatives, the positives, and the overall experience. So hopefully people learned a lot from that. And then also just it piqued hopefully people's interest in evaluation, because I know sometimes that isn't the most exciting topic for people, but hopefully people can take away from your evaluations that it isn't necessarily scary, and it is something that we can do, and there's lots of benefits that come from it. And so thank you very much, both of you, and thank you, Ian, as well. And as I mentioned earlier, we'll send out a link to Project Impact Healthy Aging website if you want to learn more. And of course, you're welcome to connect with Ian if you have any questions. This current cohort is full, but of course, as he mentioned, there will be the next intake coming up, I believe, in the summer for the newest cohort after that. So hopefully some of you have been inspired to follow up and participate in the future. All right. Well, thank you very much, everyone, for attending. And we get to get 1 minute back in our day. So thank you, everyone. I hope you have a great day. All right. Take care.